Let's welcome to the stage Senator Ed Hernandez. Thank you, sir. Got a microphone over there for you.
Okay. Want to just stand up?
Either way, you want to stand? We can.
Sure.
I mean, I've been singing and dancing since, right?
Yeah, is this on?
Right
yeah,
on.
by all means, let's stand.
Well, first, let me ask you, sir, how does this year in 2018, with all the politics, and we'll get to some of the politics in a minute, how does it compare in terms of health policy to other years during which you've been serving in the legislature, serving as chair? Are politics more prominently infused into the policy conversation, or do you feel like it's just always been this way, it's just another year?
So my answer is concern. And I say concern especially from the legislative perspective, but also from the consumer perspective as well as the patient perspective, coming off a very interesting election 2016 and the potential repeal and replace, and then of course, not the repeal and replace. And I think the only thing that's ever occurred bad, at least with the Affordable Care Act, is the individual mandate. So there's a lot of reaction and a lot of concern. So that would be my immediate answer.
Mm-hmm. Have you, there are a lot of big bills in this legislature from last year and in recent years. Why don't you just first give us a rundown of the bills you're spending more of your mental energy on? We'll get to some of the other moving parts in the legislature, but what are you spending your time on?
So, I mean, first let me put things into three buckets that I've done ever since I've been chair of the Senate Health Committee. The three buckets that I look the world of health in is, number one is the success of the Affordable Care Act, because you were talking about a social justice and what our responsibility to our patients and individuals in this country. Number one is that that's successful, because that's what we have right now. The second thing is access, and that's access to care to the most vulnerable populations. And then the third thing is controlling healthcare costs. So those are the kind of the three pillars that I've always looked on. Again, going back to your first question, with the repeal and replace, there's been a lot of reaction. So everything that I've been putting a lot of emphasis on this year have been pretty much defensive, making sure that we in California continue to move forward. We in California continue to have a successful health care. As you know, in the Assembly, I don't know if Jim Wood's going to be speaking at all, but they've done a series of hearings to talk about single payer or everything. For example, one of the bills that I'm dealing with right now is the Medicaid work requirement. And it's a statement on behalf of California, hopefully gets to the governor's desk to say that even though the president is allowing through a waiver to allow states to require work, I believe that that's not the case. I think in California, well, all states should follow our lead as well, but we have to make healthcare easier for people to get it, not harder or more difficult. The other thing that we're working on is to try to make sure that the health insurance markets are stable. Obviously, I mentioned the individual mandate is gone. So I'm taking the carrot approach instead of the stick approach. And keep in mind that the stick approach for healthcare is the mandate. And keep in mind that that's the most unpopular thing that in the country that most patients have. So I have a bill right now that we're trying to help with the subsidies of patients between Medi-Cal and 400% of poverty level to make sure we can reduce that cost of health care and make sure that they have access to care so we can ride this wave, this uncertainty that's occurring. And California's going to do it. We're going to do it. So those are some of the top things I'm working on at least.
Tell us your view of this single-payer momentum in the legislature. It got through, or a statement of support effectively a statement of support got through the Senate relatively quickly, stalled in the Assembly last year and is continuing to play out. Some people think that this is pure electoral politics. Some people think it's a reaction to President Trump, but maybe not the end. Maybe there's some place in between single payer and where we are today that will be the end. Why don't you sort of sketch for us how you view that issue and particularly how it's playing out in the legislature?
Sure. So I think it's a little of everything that you've talked about. Obviously, the politics of, the left, the politics of the anger to what's going on with our president right now. But I think the message is still the same. I think the message is we need to get to the point where we have universal health care, where we have every single person in this country, and especially in California, that has access to affordable health care. If you look at the successes that we've done in California, especially with the market-based, the Affordable Care Act, we're at, 6.7, 6.8% uninsured. So I think what the single-payer conversation has done, and obviously what's happening in the Assembly with some of the recommendations that are coming out, it continues to put a spotlight on how do we make sure we reduce and have no one that's uninsured. But I think the things that are missing from the conversation right now in single payer, which we have to talk about, is controlling cost. To me, that's what we have to do, whether it's, through, when you're looking at the markets that are starting to consolidate right now, look what's happening with our Attorney General in the state of California that's suing Sutter. So we have to start looking at how do we control cost and also shift the conversation more, besides controlling costs, how do we make sure that we have value-based health care so that we shift from providing health care based on providing a service to making sure that we reimburse to keeping people healthy. And I think those are the conversations we have to start bringing more to bear.
So I think language is super important on this because I think people use words but actually have different meanings on them. I heard you talk about universal coverage rather than single payer. Or single payer folks talk about single payer. I think sometimes they might mean universal coverage, they might mean cost containment, but they use the word single payer. What do you think the term single payer means in the political context of California today?
Real simple. It means you have one entity that pays, that's the state of California. If you look at the federal government, it's Medicare. At the federal level, they send dollars down to the state. So if you think about it in buckets, you have a third paid, roughly, a third through Medi-Cal, a third through Medicare, and the other third or so is all that whether it's business, individual market, et cetera. And I think if you take all of that money and put it into one entity, and then one entity, that being government, the state of California, pays the premiums, sort of like at the Medicare level. So to me, that's what single payer is, and that's what I think they're espousing to.
And so you think that sounds like there's maybe no confusion, or you don't perceive confusion in the language that when people say single payer, they mean California purchasing healthcare on behalf of all of us.
Yes, and that's what the bill is. That's what 562 is.
Yeah.
So.
Do you think this conversation would be different if Governor Brown had maybe been a little more of a healthcare governor? In other words, you were maybe the most important leader, certainly one of the most important leaders in California health policy, since the implementation of the Affordable Care Act. Governor Brown has been, less innovative as a policymaker on some of these topics. Do you think that, this is in part a backlash to, less leadership from him than we might see from a future governor?
I don't know if I would put in those terms. Let me just tell you my perception of this governor. He has done an incredible job with this state. He has taken his fiduciary responsibility where I believe he wants to leave the state much better than it was. Obviously, a priority that seems when you read in the papers is the twin tunnels, the high-speed rail, balancing a budget, rainy day funds, putting money into reserves, all of that. But to say, honestly, that he is not a governor that believes in health care, I don't agree with that. And let me tell you why. That may not be in the headlines, but let me tell you what California has done, and this is all under his watch. We have had one of the most successful exchanges in the country, have signed up more individuals than anyone else. We have dropped our uninsured rate by half to what I said, 6.7, 6.8, all under his watch. The other thing he's done, he signed into law, my bill, the 10 essential health benefits, all of the patient protections that we've implemented through the Affordable Care Act. He signed into law, which I did a press conference with him, signing ceremony, the Medicaid expansion. We're a third of the population. And if you think about this, I'm trying to use a polite word, is how cheap as he is. That's a lot of money we're spending in Medi-Cal. The overall budget for Medi-Cal that we have in the state of California combined from federal and our state match is over $100 billion. This is bigger than most countries' economies. He signed into law my bill smoking from 18 to 21, and he signed into law SB 17 to bring transparency to control cost. So yes, I think when you think of this governor, you don't think of him as a healthcare governor, but without this governor, we wouldn't be where we are in California. And I think that's a reflection of our values as legislators in the state of California of how important healthcare is to us.
You've been a leader on the issue of transparency related to pharmaceutical costs and other services within healthcare. There's been a lot of gnashing of teeth and a ballot initiative on the topic generally. Where do you think the sort of two buckets of A, transparency is today in the legislature? And we'll get into rate setting here in a second, but transparency generally, and then B, sort of pharmaceuticals, the trade-offs between quality and cost.
Sure. So we all have to understand and realize that in this country we have a for-profit healthcare system. I'm not saying that's bad. That's just who we are as Americans. But what's interesting is we have a federal law which wasn't overturned, and it's clear that the people of this country, and you've made in your opening remarks, they want access to health care and they expect it. Okay? So we have a conundrum because it's a for-profit system, but yet we are mandating that every single person has health care. Okay? And when we expect that and require that from government, well, I'll tell you, the consumer is going to expect what? They're going to expect a low premium. They're going to expect quality health care. They're going to expect that they're going to have access to care, the doctors in rural community, they're going to expect that, okay? And I'm going to eventually get into where, my balance is, because I still believe we have an entrepreneurial free enterprise system, and I'm not quite there yet for rate setting, and that's why my approach has been through transparency to try to control costs. But I'll tell you one thing. If we and you, and I'm going to challenge you, if our healthcare system doesn't figure out a way to work within this economic system that we have and control cost, and the consumer, guess what the consumer is going to do? They're going to demand it, and they're going to expect it from government, whether it's the federal or the state level. And then you are going to see rate setting. And I'm hoping, and my challenge to you is that we as a healthcare industry figure that out, because it is the responsibility of an elected official to be responsive to the constituency, to the people of this state and the people of this nation. And I don't know, you probably may get into it, but the Colorado bill right now is just that. It hasn't come to my house, but I will take a real serious look at it and may make a decision to support it, to have that conversation, because that's the big part that's missing, is controlling the cost. And that's, I think, the things we need to talk about.
Let me ask, again, I do want to spend a little more time on that bill, but let me ask sort of a basic philosophical question. I think you've stated and you've demonstrated through your legislative leadership that you are, you generally want to defer to the market to figure these things out. Do you think that, let me make a philosophical statement that I know some share, or some hold rather, and see what you think about it. The healthcare system has failed and will continue to fail to move and reform quickly enough, absent government action of some sort. I'm not saying that's true, false, or indifferent. I'm saying some people think of it. What do you think of that? Has healthcare, the system writ large, demonstrated that it cannot move quickly enough to reform itself and that government action is needed? Or do you think that's too much?
I don't think the system, I think the system will adapt and has adapted, and it can, and it will adapt very, very quickly. Let me give you an example. Before the Affordable Care Act, and before we had guarantee issuance, you had, pre-existing conditions, maximum out-of-pocket expenses, the system that we had before, and then once the federal government implemented it, I can tell you, speaking to everybody, health plans, providers, hospitals, sales of durable goods, pharmaceutical. I mean, there was so much uncertainty because we as human beings are creatures of habit and we don't like change. So government is saying, we're moving in this direction, right? Well, guess what happened? We adapted. I mean, there was talks about, oh, it's going to fail, whatever. Guess what? The entrepreneurial healthcare system adapted, and it adapted pretty quick. And let me tell you how it adapted. And I don't know, it might be good, it might be bad, but where we've adapted is we've adapted in consolidation. Consolidation of markets. You've got health plans buying up health plans, you got hospital systems buying up hospital systems, and I even forgot the new acronym of CAPG, but there are more IPAs forming now because the day of the independent small practice is gone, because in order now to be competitive and because of the pressures of price control, you have consolidation because you need scale. And you're seeing, the consolidation of markets. So is that good or is that bad? That's good, possibly, to compete, but that could be bad. And this is where government, I think, might step in. It could be bad because if you start forming monopolies, prices can go up. And guess what? You're going to have that balance again where government's going to step in. And guess who stepped in? Our Attorney General. So these are the challenges that we have in healthcare. That's why I'm posing them to you is, how do you adapt, but more importantly, how do we control the cost?
Do you have a professional and public opinion about the Attorney General's lawsuit against Sutter?
I think he looks at what the consumers and the concerns that we have and the concerns that we have in our market. I think he appropriately filed a lawsuit, and I think he's doing it for the best interest for the people of the state of California.
Yeah. On the not the reproductive health care bill, but the rate-setting legislation, I think there's some significant momentum there from folks in the Assembly and among key stakeholder groups. If that were to become law, and it may not be this year, maybe a few years from now, you will be on to bigger and better pastures. What do you think the elements are? What are the elements that will need to be in that legislation for it to get through the legislature? In other words, what are some key things where you're already seeing these are the kinds of conversations that are useful to have, but these are the outcomes we need to get to in order for this legislation to actually pass? Right.
So first of all, let me make it very clear that I haven't taken a position on this bill. I did see some of the testimony, but I haven't read it. But I will tell you that that bill, I believe, is a response to the increasing costs of rates. Okay. Mm-hmm. And if you look at the amount of money we spend in this country compared to the rest of the industrialized world, and if you look, and you guys did a survey earlier with the response by the consumer that they're not happy with their health care, we have worse health outcomes in this country compared to other countries, but yet we spend more money. Okay. So I think that's possibly a reason why you have some concern. And going back to my challenge to everybody here is if we don't figure it out, guess what? Government's going to force us, the healthcare industry, to regulate. And I think this is a response. So if it were to move forward and if you start to see some type of rate setting, I think the elements that are going to be in there should be in there. Number one should be the viability of any entity. You don't want an entity to go out of business, number one. But more importantly is that to make sure that the workforce, the amount of physicians that are being paid, but you base it down into various regions because there's various cost factors from northern to southern, California to coastal to central. So there's a lot of things that have to go into the mix. And ultimately, you might someday, maybe in the future, see some kind of PUC system that actually looks at everything to start setting rates for what we do.
PUC, Public Utility Commission?
Yeah, like a public utility system. And I'm not saying I'm advocating for that. I'm just talking about if you look at the future of what could happen with this system, because the consumer is going to want to continue to have health care.
You're running for office this fall. How's that going? You're running for lieutenant governor of the state of California. Tell us about it.
Yeah, so I got a real simple plan. I've got this strategy. It's in June and in November to get the most votes. Yeah, it works all the time, and I'm on the path to do that.
Good. What lessons do you take from healthcare into the lieutenant governor's office? Let me preface your remarks by saying sometimes the lieutenant governor's office or the lieutenant governor's office is often a position without portfolio, but in coordination with the governor, the lieutenant governor can take on a range of topics. Healthcare is not going away. When you win in June and in November, do you see yourself playing a role on healthcare and health policy as lieutenant governor?
By all means, and I absolutely feel that this is the most important office next to the governor's office, and should I get lucky enough to get elected, number one is to work with whoever the next governor is, to make sure that we work hand in hand and have similar values that we achieve. But here's how I'd use that office. Because of my passion, number one is being a provider, providing care in an area of need, and our practices still see well over 50% Medi-Cal patients, lots of patients with diabetes, high blood pressure, and because of my passion and being chair of the Senate Health Committee, is to continue to be at the table. I think I'm the person that can bring people together, whether it's labor, whether it's consumer groups, whether it's business, whether it's pharma, whether it's the health plans, whether it's the medical groups, and sit down and try to figure out how do we make sure that we can make this system work without seeing those numbers where you have angry, consumers that give this healthcare system poor remarks. I want to be part of that discussion. I don't want to go away. So I want to use that office as a bully pulpit to do that in healthcare. And then the other thing I really want to do is, and I know it has nothing to do with healthcare, but it indirectly does, is to look at education, because the lieutenant governor sits on two very important boards, CSU Board of Regents and the UC Board of Trustees. And it does, now that I think of it, it does relate a lot to healthcare, because if you look at our healthcare workforce right now, we have a huge provider shortage. But more importantly, we have a workforce, not only in healthcare, but throughout the entire state of California, that does not reflect the demographics of the state. And you have patients in rural, inner city, African American, Latino, that have doctors, nurses, optometrists, dentists, that sometimes don't look like them. And I think we need to look at making sure that our workforce reflects who we are as a people as well. So those are the things that I'm going to be doing.
As a successful, by any measure, politician, let me ask you this, maybe less about your race and more about California politics and maybe national politics. There are some issues that are third rail issues for one side or the other. The Second Amendment is very important, often to people on the right. Reproductive health care is important for people on both sides. Not that it's not important, guns aren't important to both sides, but people on the right really get fired up about it. Do you think that healthcare, and specifically some sort of single payer model, is becoming this litmus test for gubernatorial candidates, for our 2020 Democratic nomination primary and caucuses for president? Is that a new litmus test for Democrats?
Yes, I would agree. I think it's a litmus test for the Democratic Party, but I don't believe healthcare anymore is a partisan issue, whereas I think prior to the Affordable Care Act, it was used, and even after the Affordable Care Act, look at how many times they've tried to repeal and replace, send it to President Obama, it obviously never got signed. And the reason why I say that's no longer partisan is because the people of this country have spoken that they want health care. And you say that it's something I believe we all want, and we just got to figure out how we make it work.
Mm-hmm. What do you make, I know you've got to run to get back and manage your legislative duties. I just want to ask a couple of quick questions. What do you make as a legislator of this sort of federal interaction with the Trump administration and its aggressiveness towards the state of California and California's aggressiveness towards it? How do you sort of view that as a senior legislator?
So when I look at what's happening in our country, I don't think I've ever seen more division. And this is me. I mean, you may disagree with me, from whether it's trying to repeal and replace the Affordable Care Act, whether it's attack on women's issues, whether it's attack on minorities, building the wall, the ban on Muslims, banning LGBT community or individuals in the military. There just seems to be a division in our country. And to me, that's not good. I mean, we need to find a way that we unite as a country. I mean, that's what we need to do. So my response to you, look, California, yeah, the reality is California is a blue state. We have all constitutional officers that are Democrats. We have the state assembly and the state senate is majority 2/3 Democrats. So, the values that we have, we don't agree what's going on at the federal level, and that's why we are pushing back as we are, and that's our role, and that's our responsibility as what we represent and who we represent in this state. So I think it's just sort of the natural ebb and flow of what happens, within the country. Look what happened with Texas during the Obama administration. We're doing what Texas did to Obama, but that's what states do.
Yeah. Last question. What counsel or advice would you give to this group of healthcare executives, of health policy advocates? How do you take your wisdom and translate it into their operational and advocacy duties?
Sure. So my advice and my challenge to you is, how do we figure out that this system that we have, that is a for-profit entrepreneurial system in the great United States of America, how do we make it work so that we can make sure that we control healthcare costs, provide the highest quality care, but more importantly, how do we make sure that consumers, so that you don't have these kinds of questions coming back to you that they don't like their healthcare system, and how do we do that so that government doesn't have to step in and regulate the rates of what we do? And I think forums like this, and thank you, number one, for what you do, because I've been invited to this, I think, 4 or 5 years in a row, and I've always enjoyed it. But forums like this is to figure out how we make healthcare work in this country. And I think this is the greatest country in the world, and we may have the best healthcare in the world, and you guys can do it. So that's my challenge to you.
Senator Ed Hernandez, thank you for joining us, for your leadership. Let's give him a round of applause.
Thank you very much.
Thanks, sir. Appreciate you being here. Good.